Hello everyone, welcome back to my channel. This is MD Suren back with another update on coronavirus, and this is the most important update, so stay tuned. Let me highlight what we will talk about today. So we'll talk about the number of cases so far here in United States, globally, and in some other countries. We will also talk about what are these symptoms. What do we know so far from our previous video or so far in these last 3 to 4 months of time frame when coronavirus is in circulation. We will also talk about incubation period. Has anything changed from the time we heard last update about coronavirus? Anything on horizon as far as the treatment is concerned? Next, we will talk about what to do if you're healthy, how you will be able to prevent or avoid the infection. We will also talk about if you are sick, then what happens. That's the most important part, because looking at the panic, what is all around us, people are really scared, people are really afraid. So I'll try my best to highlight some of those areas, and we will try to touch base those points to ease the anxiety. Next, we will talk about who is at high risk. Is everybody across the board at same risk, or is there certain section of population at high risk? And what do we know about when we say the coronavirus has a death risk of about 2 to 3%? Is that death risk distributed evenly all across the population, or is the death risk certain population is at high risk and there is a section of population which is at no risk of death? We will also talk about hand hygiene practices. We will talk about quarantine. When we say you need to self quarantine for a period of 2 weeks, what does that mean? Then we will talk about travel. Should you travel? And then use of masks. Does everybody need to wear mask? If you do need to wear mask, what type of mask you need to wear? And what is the correct method of using a mask? Because if you're using the mask inappropriately, it is only giving you a psychological prevention, but not a real prevention from the disease. So let's jump in. As we know so far, we have about 140,000 cases globally. 1,700 of those are here right in the United States. Other countries which have over 10,000 cases are Iran and Italy. Countries like India has close to about 80 cases, and pretty much the virus is in all continents except Antarctica. So I don't think there's any country, barring maybe few, is immune to this. So this information is very pertinent to each one of us and help me spread this message when it comes to spreading the right information. This is what you could share with everybody. Now, the second thing we're going to talk about is the symptoms. So what are the symptoms of coronavirus? A learning so far over these last 3 to 4 months time has given us that majority of patients who have coronavirus infection do have fever. Second thing they do have is cough. Now that's a dry cough. That means whenever you cough, you don't bring up any phlegm. And a third thing, it causes extreme fatigue. You always feel tired. Now these are the most important symptoms. Now, as we know, these symptoms can present with any other viral infection. So it is important whenever we are talking about an infection, the idea of getting these symptoms or this information out is not to spread panic. The idea is just to spread the right information, and we will talk about in the later part of video, even when someone have these symptoms, what are the exact expectations or what are the things to do. The other symptoms we may have is myalgias, which means muscle pain. We may have symptoms like shortness of breath. We may have symptoms like runny nose, headache. We may have symptoms more like diarrhea, which are increasingly rare. So in that order, take these symptoms. So these are the coronavirus symptoms. Now let's talk about who is at risk. As I mentioned earlier, not everybody is at same risk of infection. But there are people who are at very high risk of contracting this infection, and unfortunately, the very same population is at the high risk of dying from coronavirus. Now, viral infection, and why do we care about dying? As with any virus infection or any viral infection, especially when the virus has a tendency of changing its identity, that happens with the flu virus. That is the reason we have to take flu shot, because the flu shot what we take for or what we took for last year, that flu virus was a different virus than the incoming year or next year, where virus has changed its identity. So the photo tagging machine, or whatever immunity, which is scanning these types of protein or viruses, it is not able to identify, because when it does that photo matching or picture matching, it realizes that it is no more a same virus. So whatever immunity we have built is pretty much of no use, and that is why the new vaccine comes in. Now, we don't have that luxury with the coronavirus because it's a novel virus. We don't know about this virus, or our body does not have any memory or immunologic memory of this particular virus. And that is why we need to worry about that whether this virus will be making someone, will infect somebody or not. Now, let's talk about some other things. The elderly population is at highest risk. Now, as you can see in the video, these are the numbers. So if you are 80 years and above, these are the patients at much higher risk of dying. And if I can take a reference of my numbers, the death risk in this population is about 15%. So that means if people who are 80 years and above, and if they are contracting this virus, 15% of them is a mortality so far. That means 15% of these patients might or are at risk of death, and that's what we know so far from these other countries' experience, especially China and Italy. The other age group is 70 to 79 years of age, and the chances of dying in this particular age group is about 8%. Now, the third age group is 60 to 69 year of age. So if you are in that age group, the chances of death, or what we have observed, and it does not mean it's a future, it is what we know so far in the past, is about 3.5%. So as you see, as you're going down in terms of age, as you're moving from old age to younger population, the chances of death is actually going down. Now let's focus on this one. If you are between 50 to 59 years of age, the chances of death in this population is only 1.3%. Now here comes the most interesting part. In the population, or in the age group between 10 to 49, what is the death risk? 0.2 to 0.4%. What it means, if you have 1,000 people of this age group who have coronavirus infection, maybe 2 or 4 out of 1,000 are at risk of death. And the most interesting part of this is, in the infants below 10, we have not observed any mortality so far. Now that's an interesting part. That does not make kids immune. We just don't know what is happening in this age group. But yes, fortunately, we have not seen any death risk in this particular population. Now, can we say with certainty that kids are free to roam around and there is no risk? Absolutely not. Now, these are the kids are at risk of being a carrier as like anybody else. So what it means of being a carrier. If I have a coronavirus infection, virus is feeding on my body or multiplying in my body, and I am at risk of spreading this infection with every cough or every sneeze whenever I am generating, because I'm generating these the droplet particles, and anybody who is coming in contact with it directly, or if I'm infecting any surface and they're coming in surface contact, they are at risk of getting this infection. Now, the virulence of this particular virus is very high. What it means, you do not have to be in a physical contact of a person to get a spread of an infection. Now, there's a good and bad side of it. Good side is, yes, there is a way to minimize that, and a bad side is, yes, you don't have to come in contact with anybody who has coronavirus infection, but you still might be getting an infection. And we have had several news media reports of infected cases, and they are not endorsing any particular travel, or some of them have not even been out of their own city or a neighborhood, but they still ended up getting the infection. Next, we're going to talk about what are the actual numbers when people have certain health conditions. Now that means if somebody have cardiovascular disease, now cardiovascular disease would usually means if they have congestive heart failure, or if they have something like a bad heart from any other condition, they have had heart attacks or things like that, and they are having some symptoms. Now that is called a pre-existing cardiovascular condition. These patients, if they get coronavirus, they have been shown, or it has been observed that they have about 10% risk of death. That's the highest when it comes to any particular pre-existing condition. The second age group is people who have diabetes. Now, that number is about 7%. So, what it means is if a diabetic patient is getting a coronavirus infection versus someone who is a non diabetic patient has about 7% risk of death. The next pre existing condition patient group is people who have chronic respiratory conditions. Now, chronic respiratory conditions usually mean if you have asthma, if you have bad lungs or emphysema or a COPD like smoking related lung damage, any environmental lung damage, any conditions like asbestosis, these patients have about 6% risk of death. This is what we have known in terms of observed mortality. It does not mean if you have it, yes, 6% of them will be having in the future, because this mortality data keeps changing as we have more and more cases recovering. Some of these patients who have these conditions are also recovering. So this number might change. All these percentage at this point is information so far what we know as of middle of March of 2020. Next group we have is the cancer patients and patients who have high blood pressure or hypertension. These patients or these age group, these patients also have about 6% risk of death. And if you have no pre-existing health condition as highlighted in these, you have chances of death less than 1%. Now let's talk about treatment. Is there anything we know about coronavirus, or is there any particular medication regimen effective against these viruses? And so far, answer is clearly a no. Now, what I mean by that, you might have heard about in the news reports that Gilead Pharmaceuticals came up with an antiviral, it's a newer antiviral medication, and FDA did give it approval in the end of February to proceed with the phase 3 trial. Now, phase 3 is actually very good news. We do not have a luxury of having a phase 3 trial so early in the pandemic, especially in all previous pandemics. So this is something good news, and we all need to keep an eye on it. The second possible contender, which is coming from South Korea and Indian experiences. Now, two antiviral medications which are in use, already in use for HIV patients, and the third one is a medication which we are using for flu, Tamiflu, and the fourth medication is chloroquine. Now, this particular combination was used especially in South Korea and later, pretty recently, last week in India, in the city of Jaipur, where they were able to treat an Italian tourist, and they were able to demonstrate that infectivity or viral positivity is pretty much not observed in these actual coronavirus infected patients in a period which was just over a week. Now, it does not mean that we have something for mass consumptions. It does not definitely mean that you should start to look for these medications and start to stock or hoard these medications. WHO warned, and pretty much every medical body, including the local governments and right here in the United States, we do not want people to look at these medications unless they are coming in a form of an actual approved treatment. You will all be hearing about it. I will certainly be updating on my coronavirus report as and when a new treatment option comes. We do not know whether vitamin C, garlic, we have another agent called MMS, which is ingredient of a bleach. People have other information like a liquid silver. Now, these are all dangerous medications, especially the later ones, what I mentioned. We should not be using any of those. We will talk about how you can prevent, how you can stay safe, but certainly medication at this point is out of picture, and it is definitely not for a public consumption at this point. Any medication which comes for a public consumption, even like medication like a simple antibiotic like ciprofloxacin or augmentin, these medications have gone through the human trials, and it has shown that yes, they are safe to take in the particular doses for a particular duration to have an effect against a particular disease. We do not have that level of information so far about coronavirus, especially when it comes to any medication to treat or cure the disease. So that's a very important part. It is important to know what is coming on horizon, which is promising, but we do not have anything, and I do want to highlight that. Now let's talk about what should you do to protect yourself and prevent or minimize the spread of a virus. As I said, this is a very virulent virus. It is a highly contagious virus. Travel would be one thing which is advised at this point by all government bodies and local bodies, that you should not be having any unnecessary or non-emergent travel. That would be one way of creating what we call as a social distancing, or in a way reducing the exposure in the community, because at this point in time virus is definitely having a community spread, and this is what most experts believe. The second thing is hand hygiene. Now, hand hygiene is easy to say because we don't mean when it comes to hand hygiene that regular hand wash whenever you do after you use the washroom or you come in contact with any soil surface. This is a hand hygiene which is of a particular type. You have to wash your hands with soap and water for about 20 seconds at least. This is very important, and when it comes to hand washing, you would be using the soap and water to rub pretty much both surfaces, inside and outside of your hand, in between the web spaces, knuckles on both hands, areas which is at the base of a hand, and you would be doing and repeating this for at least a time interval which is 20 seconds. Now, number two is alcohol-based hand sanitizer. Now, when I say alcohol-based hand sanitizer, and I know there is certainly a shortage in areas all around us, make sure it has about 60% of alcohol at least. Now, when it comes to sanitizer, you have used the hand sanitizer, let it dry on your hand. Do not use any tissue, do not use any towel to wipe this off. Our idea is we need to let this gel evaporate or this alcohol evaporate from our hand. Now, the duration it takes or time it takes, that is the appropriate time required to kill any particular virus or bacteria. That's where it comes from. The third thing we need to talk about is the social distancing. Now, when we say, you all have heard about that we need to maintain a distance of 1 meter, especially doesn't mean that that distance has to be with a healthy person, but anyone who is coughing and sneezing, that person should be at least 1 meter away from us. Why 1 meter? Because that is the zone which is shown that virus or these droplets which are carrying this virus are traveling and staying. The other the other part we need to discuss when it comes to prevention of the spread or minimizing the spread would be cleaning the surfaces in your house. If you're in a public area, yes, again, use the hand sanitizer or wash your hands. Regular household cleaner, the CDC says regular household cleaner is shown to reduce the contamination or reduce the spread of a virus. So you can use anything, the home-based sanitizer what we are using, or even the disinfectants wipes what you have at home, those can be used to disinfect the surfaces. Now, this is very important to do if you are healthy. Now, we talked about the symptoms, what to watch for. And now let's talk about that. Unfortunately, if you or someone who you know or your loved one, if they have this virus infection, first thing they need to do is, you may have heard the word quarantine or self-isolation. Now, self-quarantine usually means that your job is to restrict or isolate yourself for a period of 2 weeks. Now, that means, yes, your life is not going to be stopped. All your human need has to be fulfilled. So you want to make sure you're in a room which has an attached bathroom if possible. If it is not, at least restrict the movement of everybody else in the house to that bathroom. That should be accessible only to you and nobody else. Number two, make sure you have all your home supplies, your regular toothbrush, all your soap, all your personal hygiene things are all in that room. Number three would be, someone needs to get you the food. So make sure you have at least 2 weeks worth of home supplies or a food supply at your home. Number four, when you are not having any symptoms or this period of 14 days is over, in that time frame, what you will be doing is, because yes, you don't know at this point whether the surfaces or any areas of that room you might have touched are still carrying a virus or not. It is safe to assume that that area does carry a virus. So use the regular household disinfectants and clean that entire area wherever you think you might have touched, and wash all your linens, your laundry, all of that with the soap and water. So that would be the thing. So this is what I mean, or when anybody says that you need to do a self-isolation or you need to do self-quarantine, this is what the self-quarantine means. Now let's talk about, no matter where you are, avoid touching eyes, nose, and face. These are the areas which are, you can consider them as a port of entry. So imagine if my hands have virus because I might have touched, let's say, this particular surface, and someone coughed or sneezed in this area, now I'm touching. Now I might be touching my eyes or my nose or my mouth, and all it takes is that your body is now at risk of coronavirus infection, assuming that there was a sizable infection load in this area, which we don't know. So when you don't know, the best thing to do is assume for the worst and prepare yourself. So best thing is avoid eye, nose, and your mouth touch, and do a frequent hand washing as I talked to you earlier. Now let's talk about that. Yes, that person has self-isolated, but unfortunately that person happens to be in that 10 to 15% of cases where they will have a severe viral infection. Remember, 80 to 85% of these patients have mild infection. All you may have is fever, some fatigue, dry cough, and you'll recover. But let's say, unfortunately, if that person is in 10 to 15% where they are having a severe sickness, in that particular case, let's say, watch for shortness of breath. That would be one symptom I would ask you to watch for. If you are short of breath, all it means is now virus is infecting the areas of your lungs. Maybe you're developing a pneumonia, um, and you may need an assessment by a healthcare provider. In that case, do first thing, call your doctor or clinic. Do not just drive, just call them and say, I'm having these symptoms. This is what I have done so far, and I'm experiencing these symptoms. Because we as a society have an obligation. And our obligation is, yes, we did everything our best to protect ourselves. Maybe unfortunately I ended up getting it, but now I have other obligation that I should do I should do my level best, where I am restricting the spread of this virus to anybody else. Because those folks who are at the, let's say, reception counter, or the nurse or the doctor who is coming to see you, they also need to stay protected. So not just they can help you, but they can also help maybe hundreds or thousands of others who would be who are potentially at risk. Now let me also touch on use of mask. As you have seen, along with the hand sanitizer and the regular household items, masks were the first item which was in a shortage. The use of mask is a good thing, but who need to use it? If you are sick, yes, that would be one criteria, or that would be one area where you need to use a mask. Number two, if you are caring for someone who is sick, if your mask is soiled, that means you have coughed or sneezed and now this is wet, that mask is of no use. You need to discard that mask and use a new one. If you are healthy, you do not need a mask. You will be using these hygiene practices, the respiratory practices. So essentially what it means is, if I'm coughing or sneezing, yes, I would be covering my cough. I'll be using maybe a handkerchief or a towel or anything and just cover my sneeze. So we have to do everything best to restrict the spread of or the generation of these droplet or spread of the droplets. Now I'm going to share a few links to talk about active tracking, the live tracking of coronavirus cases. I will also be sharing some links from the World Health Organization websites about what is the correct use of masks. So please go through those videos as well. Again, this is a time not to create panic, not to spread panic. We have an obligation to protect ourselves, protect the others, and we have an obligation to share what is the right information. And help me also share this video to your friends and families. Thank you again. This is MD Surain, and this was the latest coronavirus update I wanted to share with all of you.